Good afternoon, this is Dr. Do again. This video is alphabetic list of problems, still on C. Today I'm not going to talk about specific problem, but talk about the cognitive behavior modification. Actually, the formal term should be called cognitive behavior therapy. But if I put the word therapy here, which means that's the duty, responsibility for the physicians, they provide therapeutic change in terms of cognition and behavior. But today I'm talking about the modification which should be tried by the patient yourself, or even though we do not have a particular disease diagnosed, but this cognitive behavior modification suited for in general any diseases or any daily life. So let's start from the beginning. I don't think it's any, because this is a cognitive behavior modification, refers to those chronic or long-term, so basically not for the emergency, unless you have severe depression or severe any other disease associated with depression. So you need and you have some thoughts very severely hurt yourself or hurt the others. If that's the case, you need to see the physician, go to the emergency room, or your family probably will also recognize and take you to the emergency room. Otherwise, related to the cognitive behavior modification, really refers to the daily life with or without medical conditions. For example, a very simple overweight is not obesity, so it's not disease yet, but just not ideal body weight. So cognitive behavior modification, you tell yourself, first of all, your cognition change. You realize I am at the borderline. If I move one step forward, I might go to the obesity, which is a disease. If I go back one step backward, doing some change, modification of my lifestyle, I will be maintaining ideal body weight, will be keep healthy in the long run, will prevent many complications or cost effective, and also my life will be happier. So this is the fundamental. Could be like simple as this, overweight, or some event. For example, you just had a trauma or accident, or life just did not go as you expected, a big surprise, or not in a good way. So you deal with the situation. Start with cognition, how to see it. This is kind of psychological and also medical related. So I heard there's a half-filled cup, half water, half air. So what do you see? So again, stay back a step to look at the half-filled water part. We'll make deep breaths and relax and change it. Okay, so there's a common saying, it could be worse. So if that mind come to you, so you relax, but it's not like you're dwelling on that could be worse. Because of this, you relaxed, and then you gain the strength to move on, moving forward, doing better. So this is the fundamental cognition change will change your life, and not only medical, but also psychologically and dealing with daily life. And also in terms of the behavior, of course, use the overweight as example. So you realize you're overweight. If one step forward, going to be obesity, and coming along with the hyperlipidemia, cardiac or diabetes. Now you realize that, which is cognitive. Okay, so I need to change it. Then start with behavior change, exercise, eating healthy diet. So this is the modification for your lifestyle. Very simple, but it's easier when saying it compared to doing it, because we're all busy. There's so many things going on in our life, and in terms of modification, so you did this. For example, you had short-term depressed from the whatever happened in the life. We all had those moments, and you did some modification, and also this lifestyle modification for overweight. and you tried, you did the modification by yourself, you change your lifestyle, you change your point of view, you change your behavior, but did not improve. If that's the case, I recommend you, if severe impair your daily function, interfere with your jobs or daily life, see a physician, seek a medical professional help, so which will provide the systemically cognitive behavior therapy. So in terms of the therapy, it's like there's a very well scheduled, very well planned, and step by step to change everything, to work with you together. Sometimes we have the motivations from the others. We try the best, like I said, do the modification first. If it doesn't work, regardless what is the cause, either physically or psychologically, or there's some significant event, if you tried a couple weeks or couple months, did not lead you anywhere of better. So if that's the case, seek the professional cognitive behavior therapy, because the therapist, this therapy is not like what I said here simply. They have the guidelines, they have the schedules, they have the way to communicate and to identify your why you couldn't do it, couldn't make it while you try by yourself. So these are the trained specialists. So seek a professional. The most applicable situation for the cognitive behavior therapy are those really mentally conditions like bipolar or depressed or anxiety. So regardless, before you are diagnosed of the disease and you just feel short time stressed, or you feel worried but not diagnosed as anxiety, or you feel like you have to keep clean and not to the point that you cannot control yourself. These are the early stage. If you change your cognitions, you change your point of view, might and come along with the behavior changing. So might stop there and you feel better going the other way, which is perfect. But if you kind of tried a couple months, you're still not feeling better, things may even getting worse because of the pressure still there, cannot be removed. If that's the case, then move upper level for the cognitive behavior therapy instead of modification. So this is a very in terms of how to do it, how to change the point of view, how to modify. You can start from the questionnaire for yourself. For example, what is the cause for this problem, overweight? And you identify either not exercise enough, or eat too much, or there's some other family reason, family genetic, or any or lifestyle, or the job stress, etc. And you make the list what the cause. Okay, and then you tackle one by one. How can I change my behavior in terms of that causative etiology caused my overweight? So if it's lack of exercise schedule, 30 minutes a day for 5 days or 7 days, even walk will change your cognitions and change your physically, give you strength and lose weight. Or eating not eating healthy, then try to limit those. It's not easy to do, but if you determine to do it, it's all in the mind. If you're in the contemplative stage, then you can change it. So you can do it. You can put in the action to start doing this. So then this is the very simple, straightforward. In terms of the psychological problem, like you worry too much, not diagnosed anxiety yet. So for example, then you do the same thing. Get a questionnaire. What caused my worries? Is there anything I can change from the worry? Of course not. And you get the answer, then you tell yourself, I'm going to stop worrying and I will take my time, do the physical activities, would limit that unhealthy thought. So this is a very simple, straightforward, but it's very useful. I call it cognitive behavior modifications. If it doesn't work, regardless what is the cause, physiologically, psychologically, or pathologically, any of them, I just move up to the level for the therapy, cognitive behavior therapy, seeking the professional help. So this is the video for for today. Hopefully it helps. I'm sure you know it probably. I just put everything together as a remind. If something happens, just get questionnaire, ask yourself, what is the cause? What can I do to overcome these feelings, which impairs our health and condition? Okay, thank you for watching. I will see you next time.